lowest rates of life expectancy at birth, lowest mortality rates. Achievements of Kerala in healthcare are considered exemplary in India and are even comparable to the developed countries in the world. Even at this stage, there is much scope for improvement. Not only should the achievements so far be sustained, but the health sector should be pushed to reach its full potential. But how simple is the system? Long, endless queues, endless paperwork, OP ticket hassles, lack of quality control in hospitals, etc. plague our healthcare system at present. The time has come for healthcare in Kerala to take a leap into the future, a paperless, hassle-free, high-tech future. eHealth. eHealth envisages an effective IT-enabled integrated framework to ensure efficient and quality service delivery to the common citizen. It will provide a centralized database of healthcare information of each citizen, allowing a complete understanding of health issues and also a proper perspective and close monitoring of the functioning of public health workers. The vision is to build an elaborate electronic platform for health-related data storage, which will hold complete healthcare data about all the citizens in the state. The first stage of the project is that of survey, in which basic information such as name, age, gender, etc. are collected. Once the details have been gathered, each individual will be issued a unique ID. When a patient with a unique ID visits a government hospital, at the reception his unique ID will be entered, whereupon all his details and economic status will be made available. Here, he will move on to the pre-check queue. In pre-check, his basic details such as weight, height, blood group, a list of symptoms for the disease for which the patient wishes to be treated, etc. will be collected and fed into the system. Next, he reaches the doctor. The doctor will already have with him all the details collected at pre-check. Here, the doctor may either enter the lists of tests that require to be done, or if no tests are required, the doctor may fill in his diagnosis and the list of medicines. If the doctor prescribes a list of tests, the patient will be sent to the lab. Here, the list of tests required by the patient will have already reached. The tests will be conducted and the results entered into the system and sent back to the doctor. The doctor may then enter his diagnosis and medicines along with their dosage. At the pharmacy, the pharmacist, on entering the unique ID, will receive a list of medicines required by the patient, and they will be provided. There is also an option wherein the doctor may refer the patient to the hospitals with better facilities and options. With eHealth, all hospital processes from registration, outpatient consultation, inpatient admission and laboratory diagnosis to discharge of the patient will be automated. This system, once in place, will transform healthcare the way we know it. The advantages are: all data needed for health planning and monitoring of diseases will be readily available. It will also provide a huge impetus for disease surveillance in the state. With the kind of data this provides, the healthcare centers in the state will be able to plan ahead with regards to the availability of medical stocks, staff, etc. It will ensure optimum quality control in hospitals. The case history will ensure that the doctors are able to plan out the treatments required. A clear, on-record case history will make things easier for the patient. It will also provide a scientific analysis of the healthcare data to monitor, identify, and suggest corrective measures to maintain the health of the society. eHealth is an ambitious initiative conceived with the objective of modernizing the public healthcare domain in the state to ensure optimum use of resources. The success of this project will contribute enormously in improving the lives of common man who depend on the public healthcare institutions in the state.